Hello? Hi? Are you there? Oh, yeah. Hi. Dietitians still exist. So this is the news story now. I know he's been working on this for a while, and this is one of his big triumphs. And let me just... That's better. On the surface, there's nothing wrong with doctors knowing more about nutrition, because let me tell you, I've worked with a lot of doctors who have given pretty subpar advice. The problem isn't doctors knowing more about nutrition. The problem is doctors do not have the capacity to treat nutrition-related issues. There is a nutrition specialist, a registered dietitian, who does that all day. But a doctor is getting increasingly less and less time. They're experiencing more crunch time to get more patients in, to make more money for their medical systems at the cost of quality of care. I think there's a fundamental misunderstanding of what dietitians do. I think that people think we just tell people, eat your fruits and vegetables and you'll be good. But to succeed with nutrition, there is so much that goes into it other than educating. Right now, what a doctor has capacity for is, oh, your blood sugar is high, you can't eat any carbohydrates, or they more typically say you can't eat any sugar, and some of the really misinformed ones say, don't eat fruit, which is not right. If they get more nutrition education, they might cut that fruit part out, but that's the time they have. Don't eat sugar or carbohydrates, your blood sugar's high. What I do is when I see a patient for the first time, I spend an hour with them. And part of that is I don't work under a healthcare system. I'm self-employed. I do private practice, which gives me that luxury. But when I worked in a doctor's office, I got at least a full half hour to do an intake where I look at their diet history. I look at their medical blood work. I look at their medical history. I ask them about their job. I ask them about their sleep. I ask them about their stress. I ask them about their exercise. I take all of these pieces and I put them together to form a plan to change their behavior, because most people are not dumb. They know they need to eat fruits and vegetables, but their behavior is getting in the way of that. Dietitians wear multiple hats. We have to know all about anatomy and physiology, biochemistry, how foods affect the body, down to the molecule. Then we also have to know how to interpret things like medical lab work. We have to know a lot about metabolic diagnoses, so we have to know about diabetes and how it affects all parts of the body. We have to know about cholesterol and heart disease and how it affects all parts of the body. A lot of us go into specialization, so you've got cancer specialist dietitians, GI specialist dietitians. My specialization is fat loss. I do a little bit of sports nutrition, and I also work very heavily, especially with older women who are experiencing menopause. And all of that has to include not only eat your fruits and vegetables and protein, but it also has to include you're doing a behavior. How do we change that? And that's where doctors will not have the time to help in any capacity. Behavior change takes time. It takes multiple visits, multiple follow-ups with a dietitian who knows how to guide someone through behavior change. I can't just give someone a list of foods to eat and send them on their way. So I have follow-ups with my patients. I see some of my patients weekly. I see some of my patients twice a week because they need that kind of check-in process to keep them on track. And if they start veering off, I'm right there to catch them. Some of my patients take months. Some of my patients have taken years. They are making progress, but behavior change is really hard. If you've ever done therapy, you know this. And if you ever think about therapy, no one in the history of therapy has walked into a therapist's office, gotten instructions, walked out and said, I'm never doing that behavior again. I'm done with it. And that is all to say, doctors don't have the time to do that. Their caseload is already too full. We're having a crisis with general practitioners in this country where they don't have enough time to see their patients. Patients can't get into practices. Patients are waiting an hour to see someone when they're sick. It's a mess. And doctors cannot have weekly or bi-weekly follow-ups with people to help them change their behavior. What would be most helpful here is that doctors take away the message that nutrition is important and impactful. That's what I'm hoping happens. I hope for the best with this stuff because I can't control what RFK Jr. is doing. But I hope that people take the message that nutrition is important, and then what would happen is doctors value dietitians' input and say, hey patient, you should see this dietitian for support. Right now, dietitians are way at the bottom of the totem pole when it comes to medical care. I have worked with plenty of doctors who are very dismissive of us. They don't think we're helping at all. And they also think that they know everything and that they can just say, don't eat sugar, and that'll be the end of it. Your patient's cured. No more diabetes. But I do think one big problem here with the MAHA movement is that RFK Jr. has routinely just erased dietitians. We're not in the picture. We're not even mentioned. We're not considered. We struggle with our own problems. We have no insurance access in some places. In other places, it's very limited, like Kaiser Permanente in California. They give you 3 nutrition sessions a year, and you can't see a dietitian more frequently than once per month. Medicare only covers people who have diabetes or kidney disease. And if you buy an expensive Medicare Advantage plan with one of the insurances, it runs by Medicare rules. So it still only covers diabetes and kidney disease and nothing else. These are things that would help, and they go by the guidelines of food helping people's health. But for some reason, we're not on the agenda here. But I just wanted to let you know, we're here. We matter. I hope you come see us. We're here to help.